Okay, so we're going to talk about something called muscle and respiratory pumps. So that's really all that it is. Here's our objective. It's one objective, but really it's two parts. What's muscular pump or muscular compression, and what's the respiratory pump? As we've discussed previously, there's venous return is the amount or the rate at which blood returns back to your heart. Now, there are times where we're going to need more blood to get back to your heart, such as exercise. And so we have ways, or our body's been designed in a way, or is designed in a way that allows more blood to get back to the heart. And it's with the help, that's not the only thing, you'll learn more if you take exercise physiology, but these are two really important things that help increase venous return. So we've got the skeletal muscle pump. Okay, and so notice here we've got muscles contracted, muscles relaxed. And notice what's going on with the muscle and the vessel in both cases. Okay, so when we contract the muscle, that increases pressure inside here, and it forces blood up towards the heart. The valves, or veins, have valves, and that's important because it prevents backflow of blood back down towards your toes. And so what happens is the muscle squeezes the blood vessel, and that forces blood up towards the heart. Okay, and it really doesn't force blood down because those valves will shut, and thus preventing backflow. And so, for example, like I said, exercise, we need more blood flow to get back to the heart. We need greater venous return. And so just the act of exercising, well, we increase skeletal muscle contraction, which makes it easier for us to get blood back to our heart. Notice that when the muscle's relaxed, the vein relaxes, and blood, what will happen is blood that shoots up will fall back down, but it'll only fall back down to this valve. And then the next muscle contraction will push it up, and the next one will push it up higher and higher until eventually you get back to your heart. The respiratory pump also is a huge influence on how much blood returns to your heart. But what's really interesting about this is it depends on what phase of the ventilatory cycle you're in. So during inhalation, notice that the diaphragm contracts and it goes down, shown by this arrow here. This increases thoracic volume, and so thoracic is up here. And when we increase volume, you actually decrease pressure. So we've created a pressure gradient where air rushes in to your lungs. And we're going to get into that more in a couple weeks. So with that pressure gradient, air comes in. Well, what this also does is it creates a pressure gradient so that blood is, it's easier for blood to go from your abdominal cavity up to your heart. But this helps get blood into the right side of your heart and into your lungs. It does not really help get blood out of your lungs and into the left side of your heart. And so what happens is the amount of blood that's in your pulmonary circuit increases. And as a result, your stroke volume in the left side of your heart decreases. So as you take a breath of air in, you're making it easier to get blood to the right side of your heart into your lungs, but you're making it more difficult to get blood out of your lungs because of this pressure gradient. So when you exhale, diaphragm goes back up, the thoracic cavity volume decreases, right? Notice that it's smaller. So you have high pressure inside your thoracic cavity, and basically what's happening is you're squeezing air out of your lungs out to the environment. What you're also doing is due to that reverse pressure gradient, is you're forcing blood out of your lungs and into the left side of your heart where it can go to the rest of your body. Okay, so exhalation squeezes blood out. So as a result, you have reduced pulmonary blood volume, which that blood leaves your lungs, goes into the left side of your heart, and then out to the rest of your body. Okay, so when you take a breath of air in, you're making it easier to get blood into your heart. When you take a breath of air out, you're making it easier to get blood out of your heart. So, two things. How does the muscle pump work? How does the respiratory pump work?